Good afternoon, everyone. My name is Farnese Armengol, and I'm a fourth-year resident of plastic surgery in Hospital Universitario Bellvitge. I'm going to talk to you a little bit about me and about the hospital I work in. So I was born in Barcelona, but as a kid I never lived in the city. I lived in Sant Vicenç dels Horts, which is a city located in the surroundings of Barcelona. It's 20-30 minutes by car. I'm sure you all know about Barcelona. It's the capital of Catalonia, which is one of the states of Spain. In Catalonia, apart from Spanish, we also speak Catalan, which is a mix of Spanish and French. Barcelona is a beautiful city with good food, good parties, beautiful buildings, beautiful streets, and a lot of history, so I really recommend you to go if you haven't. About my hobbies, the thing I most like is outdoors sport, but I think the one of my favorites is hiking. Actually, when I knew I was coming to Korea, the first thing I did was look in the internet of what national parks you had, and I'm really looking forward to go to Seoraksan and to the Jeju Island. In Catalonia we also have beautiful mountains. I think Montserrat is the most famous one. It's not far from Barcelona, and this is my favorite one. It's called Pedraforca. It's located in the north, and some people say it has the shape of a heart. I have no family, no doctors in my family, so I really don't know how I got the idea of being a doctor. I just know I felt like I was supposed to study medicine, and that's what I did. I studied a degree in Hospital del Mar, which it means Hospital of the Sea. It's located in the coastline of Barcelona, and this picture is during the pandemic. Some patients were brought outside the hospital towards the sea. So I ended the medicine degree, and I studied for the MIR exam, and I chose plastic surgery in Hospital Universitario Bellvitge. So Bellvitge is actually the name of a district in L'Hospitalet de Llobregat, which is a city next to Barcelona. It's quite attached to it. There's no clear limit between the both cities. So the hospital of Bellvitge was built in the 70s. This is the picture of how it looked when it was built, and this is how it looks right now. The plastic surgery department right now has, I think it's 17 faculties and 9 residents, so it's a quite big team. This is the picture of the residents this year, and I think these are the ones that has come here to ASAN. Laura Torrano did the residency in Hospital Sant Pau, and now is working in Bellvitge. I think she was here in 2023. Ruben came here, he was here last month. He's 4th-year resident as I am, and Marta was here last year. Now is in the last year of the residency. So what do? We are a quite big team. Most of the faculties are in 1 or 2 units. So basically, most of the surgery is breast surgery and head and neck, but we also do lower extremity reconstruction and diabetic foot, skin cancer and sarcomas. We have a recently unit of lymphedema that it got solid, I think it's 2 years ago. And we also have a transgender unit in combination with urologists, and we mostly do vaginoplasties. So what we don't do is burns, hand surgery, and pediatric surgery. I think one thing interesting about our department is that we are in charge we're in charge of the oncological resection as well as the reconstruction. And I think that's interesting, mostly during the residency, because you learn both, how to do both. And during the surgery, we're able to elevate the flap as well as doing the resection at the same time, so the surgeries get shorter. One of the recent highlights of the department was our first face transplant that we did on September last year. The patient was a male of 47 years old who suffers from neurofibromatosis type 1. He had a giant pleomorphic neurofibroma that occupied the whole right half of his face. So we did a transplant of the half face with the whole nose. It was the first face transplant with a donor that was in asystolia. and was also donor of the heart and kidneys. And that was the challenging part because the heart had to be extracted first, and afterwards, during the elevation of the face was in warm ischemia, so we had to be quick. It was very emotional at the end because the whole team was there, and it was so many hours. We were also nervous, but it was a success and everything went great. So it was great to be there. That's it. So I'm showing you some cases. This is from the head and neck team. This is a video I did for a conference last year. We have a 12 case series of alar nose reconstruction with auricular helix free flap. You can see here the elevation of the flap. We use to lengthen the pedicle because we're not used to open microsurgery. So in order to get the facial vessels, we lengthen the pedicle with a graft of artery and vein, and that we take from the pedicle of the ALT. So here is the first anastomosis that we do on table. We always use the coupler for the veins. That was the flap with the first anastomosis. And afterwards we did the first insetting, the tunnel, subcutaneous tunnel to get to the neck. Second anastomosis, and you'll see now the ICG. And the final insetting, and now you'll see the results. This is the abdominal side. So from the lower extremity team, I want to show you this case. It was a gunshot that went through. Actually, it went through both feet, but the other foot was better than this one and didn't need a free flap reconstruction. So we did a chimeric ILT with vastus lateralis muscle, and here you see the insetting. So we put the muscle through the hole and did a skin graft on the lateral side. It just passing through the muscle. So, and this is a case from the lymphedema team that we recently published about the treatment of genital lymphedema with reverse skip flap in combination with BioBridge. So it was a male, 47 years old, who suffered from hidradenitis suppurative. He underwent 3 surgeries of debridement, excision of abscesses, and was under treatment with adalimumab since 2019. So we did the debridement of the fibrosis and the skip flap, and this is the result afterwards. You can see the lymphedema reduced quite significantly. And so this is it. I wanted to talk to you about my goals at coming here. So I'm interested mostly about microsurgery and free flap reconstruction, but also I'm interested in lymphedema surgery and head and neck reconstruction. In my hospital, we're quite used to microsurgery, but you have a lot of experience here, and you do things quite different. So I'm eager to bring back home as many things as I can. And that's it. Thanks, Amiga. Question?
So why are you not doing the phalloplasties?
It's not in the public register of things we can.
So only the men can become. It's possible to become female, but female can.
I think the transgender surgery in the public health system in Spain is very recent. It's a very recent thing. So vaginoplasties got to be in the system very many years ago. Now we have to do. I think it's we do 2 every month, like mandatory. And phalloplasties, they are not in the register yet.
So what kind of surgery do you like the most?
I think right now I like a lot of things. I'm mostly interested in in lower extremity, in head and neck, I would say. But I think that's because in the last 6 months I've been there. So maybe when I start with the breast, I like it better. I'm not sure.
Okay. Thank you so much.
Thank
Have
you.
fun in some. Okay, thank you.